Hey, welcome to another edition of What's Your Gripe Senior Edition, the podcast for seniors to air all their gripes and grievances about life and life changes. I'm your host, Barb Kaufman, and I'm a carrying card member of AARP and wife of a cantankerous individual who understands firsthand what it's like to celebrate multiple birthdays. And with me today is Margie On. She is a owner of Sage Senior Transitions, where she provides senior home coaching and quality of life advocacy for families and their senior loved ones.
Right.
Her
And
mission is very simple. She likes to help seniors and their families by working with them through the stages of decision making so that they feel safe, supported, and most of all, cherished. So,
right. And I
welcome.
and I am a card carrying member of the sandwich generation. So I get it on both sides.
Okay. So
Yep.
our topic today is healthcare, getting it on both
Yes.
sides. Uh, where do we start on the issue of healthcare? It's large.
Well, I mean, it's a big topic, and you yourself have been through the entire healthcare system, as have I, trying to navigate it. And we've had a lot of response on this topic from different people. I'll just read you a couple of their gripes, and maybe we can address them then. Mary says, I have to wait 3 months just to see a specialist. Well, Mary, you're lucky because I think it's up to 6 months now to see a specialist at least,
Yes,
depending
my
on what you're
husband,
looking for.
the cantankerous one, he had some tests and they postponed it because the doctor was going to be out of town, and it was about 9 months later.
Wow. He could have had a baby in that time.
Yeah.
Probably did.
Yeah.
So, Joe says doctors just say that's normal at your age instead of really listening to my concerns. Well, that doctor is practicing ageism, isn't he? So, that's not good. And Ruth says, every time I see a new doctor, I have to start from scratch. How many times do we have to do that? That is very true.
Yeah. Well, let's start from scratch at the very beginning of going into the doctors, because then you get the Medicare questions, and
Oh,
it's those Medicare questions, and I look at them and say they're all no, and then they said, "Well, we have to say them out loud to you." Really? This is like
gosh.
the second time I've been in here in a week.
Yeah, well, that was another complaint. I can't figure out what Medicare covers, and the bills are impossible to understand. So yeah, you know about that.
Oh,
I
definitely.
hear that a lot from a lot of my clients too. It's a mess. David says, my medication costs keep rising and I don't know why some drugs aren't covered anymore.
Oh,
Well, there are big changes coming with Medicare this year. So if you aren't sure, you need to get with your insurance provider because they're going to be able to look at your medications and make sure what's covered and put you with the best plan because I'm telling you, there are big changes coming this year with that. Then there's complaints about the paperwork and everything's online now. How do you book appointments? And then someone mentioned, I feel like I'm on a conveyor belt. Doctors barely have time to answer my questions. Also,
my
sound complaints.
Oh, my husband says, he's being churned by the healthcare system. They'll find something that they'll have to send it to a specialist. And so you go to that specialist. And yeah, definitely. It's everybody. And then you think, okay, he even came home from his appointment the other day and he said, well, I'm all covered. I said, what? He goes, well, now I have three different doctors and they're all working for me.
Oh my
So
goodness.
hopefully they are. But that you have the portal which you can go into and see, the response from your medical examination. Uh, the thing that gets me now is they said they were making the portal easier for us to talk to your doctor, etc. And now because they're spending so much time on the portal answering my emails, they want to charge for that.
Oh,
So that's a new movement in to have able to pay for the portal. So we'll see
well,
what happens.
I mean that I can kind of see that because if they're talking to you, they're taking away time that they could be billing somebody for. But I mean, it's That's kind of like how it was with banking when they started ATMs. They wanted everybody to do everything over an ATM, and then they want to, you can't use every ATM that's available. You have to.
And then they charge for that, unless you're using it in their own little network. It's, yeah. Yeah, life.
Yep.
Well, we're cutting the cord of cable, and now all those streaming services are adding up probably to the same amount I charge for cable. So it's
Could
fun.
be. It
Uh,
could be.
but we're off
So,
topic. We need to get back on healthcare.
well, I mean, it's all the same churn, and it's all about the dollars.
Well, what can I
So
do as a one individual, small, aging in place woman to prepare for healthcare? I mean, what can I do to get better healthcare?
I think one thing that you mentioned in a previous thing that I thought was a fabulous idea, and people do need to do this. I see this all the time with the seniors and the families that I'm trying to help is you need to take your own notes, you need to ask your own questions, you need to advocate for yourself. Um, a lot of times some of the older seniors are just used to uh, taking the advice of their doctor, and really you need to ask more questions. You need to advocate for yourself. And if you don't feel comfortable doing that, then you need to take someone with you that will be able to do that.
Oh, that was big. All during my recent healthcare, I always had one of my daughters and my husband with me, and they took notes mainly because my mind started going elsewhere half the time they were talking. So most of the time, it was kind of laughing at myself, but how did I get here? But I made it. So,
Yeah,
um,
I mean, and sometimes it's emotional discussions that you're having, and you know, important decisions need to be made. And so or I mean, a lot sometimes I'm dealing with seniors who have dementia. So they really do need to have someone with them to be an advocate. So uh, I mean, what else can we do? We talked about notes, advocacy. Um,
the portal, making sure that your loved one has your all your passwords for everything. I mean, we have it in a notebook that just has it all broken down by everything. Uh,
Absolutely, absolutely important, because I just was speaking with someone this week, very frustrated daughter. Uh, her mother, she has the information for her mother. She has the portal information. Her father will not give it to her, and yet he is making very poor decisions for his health care and for his medicines. So unless she has some of that information and is given permission, she can't make changes. She can't help him out. He's spending almost $500 a month more than what he should on medications because he will not let her help him with that. So that's a very good point. Very good to have someone that you trust that you can lean on to help you with those types of things.
Also lists of the medications. I mean, one of the and I have it. I have a weekly, all my pills in a pill box by day to day. And luckily, I only need one part of the day. But I've heard that they're also in times of day that you can say, here's the one in the morning, here's the one at noon, which knock wood, I don't need that at this point. But I think the pill boxes and knowing what the medications, when my husband had a heart attack, I didn't know what all the medications he was on, and I just put them in a bag. But there is an app you can get to have on your phone or to just put it on a little card in your wallet that has what your medications are, what the dosage is, how many times a day do you take them, and
Mhm.
have it carried with you. Um, and also with my new hip, I have a thing that tells them exactly what the number is. And especially when I go through the airport and I send off all kinds of alarms, I say, oh, that's my hip.
Oh my
Although
gosh.
shouldn't do that.
Well, I often give out file of life folders. I don't know if I gave you one or not, but they're
No, I haven't
little
gotten one.
they're
There's my
little
birthday Christmas present. Okay.
okay, now I know what to get you. Um, they're little cards, and they come in a they slip into a red envelope that it has a magnet on it, and you put it on your fridge, and they're called file of life because um, it's where first responders often go to look if they come into your home, if you're unresponsive. A lot of times your spouse or something might be too excited to remember what your medications are, who your doctors are, who your emergency contacts are. This little file, they can easily go to it and it has all that information on there. And then you can also take it with you to your doctor's office and everything is there in one spot. So if anybody's interested in them, just go onto my website and then email me, sageseniortransitions.com, and I'll send you one. So those are very handy to have. So that is one thing you can do. Also, in response to the guy who said about being rushed for appointments, sometimes it's a good idea to ask for a longer appointment. Tell them that there's too many issues. Especially with older people, you need to slow down. I mean, everybody really does need to slow down, period, and just get the information that you need to make
Is
those.
it proper for me to ask for a second opinion?
Certainly, certainly you can and you should, especially if you're not feeling comfortable with the information you're given.
Would I go to the same hospital or should I go to a different?
Well, I mean, that's completely your call. Um, I know sometimes seniors are hesitant to do that because they might feel like they're insulting someone. But quite honestly, you have one body, you have one temple you're living in. So we really do need to take care of it. And if that means that you seek a second opinion elsewhere, that is certainly within your prerogative. And I definitely would do it if you're not feeling comfortable with the conversation that you had.
Well, I know years ago I went through a difficult situation, and a friend of mine said, "Oh, her best friend was a patient advocate at the local hospital. Go talk to her." So I did. And I mean, tell us what is it? Tell us what a patient advocate is.
No, it's exactly what it sounds like. It's someone there who's going to talk to the patient, find out what their concerns are, find out if they can help with the situation, maybe redirect to another uh, solution. But they are there for the patient. They are there to help the patient and their families with some decisions. And sometimes, and usually it's there are emotional situations that they're there to just calm down and try to help find a solution to.
And then you had talked earlier about your prescriptions. Are those little programs, are they good, like Good RX or anything like that? Or how do they go in and they say, just show them the coupon and they're required to take the lowest possible price if I'm in store A and store B?
I don't know about specific programs, but I do know there are several companies out there now that, and this is really especially helpful for seniors when they have a lot of medications and they're maybe not sure about interactions with them. It's a good idea to only go to one pharmacy, one that you're feeling comfortable with. And now there are some pharmacies that will package your drugs for you in little packets, little plastic packets they date them, they time them. So if you need to take 3 pills in the morning, you just pull that little pack out for that date and time. And they just do that for you.
Wow.
And it's also important because then if one place in particular has all of your drugs, they'll be flagged if there's going to be some type of a drug interaction between drugs. And that's very, very serious and very important. Another thing with drugs that I want to just kind of mention is if you've been on something long term, as we age, our physical body changes and will react differently to drugs. And so if you've been on something long term and you're suddenly starting to have some strange symptoms or some reactions, it's a good idea to revisit that drug dosage. You might be able to take something different or something of a less dosage with that particular one.
And that's what we talked about today, the healthcare system and the gripes from pretty many seniors, and this one included, of getting into the churning of the healthcare system and having to survive it. So how can people reach out to you and discover more about this topic?
Well, I mean, I can be reached at sageseniortransitions.com. And on there is my contact information and information about all my websites and social media and all of that good stuff.
Okay, well, thank you. It was nice learning more about the healthcare system, and it's all the time we have for today. If you like the show, please subscribe to our YouTube channel, click ring the bell, and also write your comments on what you learned or questions, and I'll put Margie on it to do the research. So if you have gripe, I'll let us know that in the comments as well, because we want your gripe to be heard, and we'll do what we can to research it. Have a great day.